Hi, Dr. Steve Geary from Steadman Hawkins Clinic of the Carolinas, and really here to talk a little bit about runner's knee pain, specifically for those who are fairly regular runners and who have pain that's really impairing that kind of thing. I'm 50, I'm a lifelong runner, so I understand a lot of the dynamics and a lot of the psyche around our specific needs and neediness as runners. Really, if people are getting to the point where they're having pain with running, there are people that run through it, obviously. There are people that get to the point where the pain impairs their running or impedes their activity, and that's usually when we interface with patients when it gets to be persistent enough or progressive in that regard. So I guess that's what we're looking at, is people that are having pain in the knee that's progressively impairing what they want to do, which is run, or the amount they want to run. Certainly there are things that are things would get more concern. If people are having recurrent swelling in the knee, if they're having focal pain on one side of their knee that's totally makes them stop running, those people are going to warrant more specific evaluation, X-ray, possibly MRI, to see what the underlying cause is. If people are not having swelling, not having pain on one side of the knee specifically that makes them stop running, but still having pain that's impairing their amount of running, that's a common problem. Most of those people we can keep functional. However, runners have to be able to modify their activity. And so if it's impairing your running, but you're still running, then the pattern of that's important. And if it's a worsening pattern and people's mileage decrease or their frequency is decreasing specifically because of their pain, then I would encourage people to back off, look at the big picture, and engage in the appropriate self-rehab, if you will. And I think that's what really here I'm addressing. Usually that's successful with some modification of running. And that does include some period of formal cross-training, if you will. So I'm not saying no running, but usually backing off, getting some baseline mechanical activity into something lower impact and more constant resistance cardio. So what does that look like? That looks like exercise bike, elliptical, flat on treadmill. And the bike's probably been studied the best, but getting that on a fixed schedule, let's say 2 to 3 days a week, building up the time, at least 20, 30 minutes, but more constant resistance, not some variable resistance program. That's going to be much more well tolerated. Then gradually adding resistance, but still doing some constant resistance program versus some stagger workout kind of program. Once people can tolerate that well and well engaged with that, then I would still be embracing that as a base program, but still overlap some run 1, 2 days a week, but still be a period of cross-training, and then backing off of that, getting back into run, but still overlapping some degree of cross-training during that time. That would be for the cardio program. Certainly connected to that is a lot of issues which specific us as runners don't always address, and that is things that we've studied pretty well that make a difference. So specifically some core strengthening, kind of more of a regimented program of that, some IT band flexibility or our hip IT band, working on some stretching of that in a more concerted fashion, as well as our hip flexor program. Then when people get back to running, a simple holistic thing of just some, icing that compressive ice 10, 15 minutes right after the run. That one simple holistic thing will also help bringing all those things into concert together, is usually successful as initial kind of home program, if you will. Certainly if that's failing over time, probably warrants, and people's activities decreasing, probably warrants a more formal evaluation. Thank you.